Welcome to this podcast on helping moms breastfeed exclusively. This podcast is part of a series of educational resources funded by the United States Department of Agriculture, Food, and Nutrition Service for use in the WIC program. Let me introduce Kathy Carruthers with Every Mother Incorporated, and we hope this podcast will help you in your journey with new mothers, to help you encourage mothers to exclusively breastfeed, to give their babies the best health benefits breastfeeding has to offer.
Hello, my name is Kathy Carruthers, and I want to welcome you to this presentation on encouraging exclusive breastfeeding. You know, I think a lot of new mothers today choose to breastfeed, but not everyone does it exclusively. Many moms start supplements of formula even before they leave the hospital for quite a few different reasons. Sometimes they say they want to give the baby the best of all worlds. They want to give their baby at least some breast milk, but then they say they also want maybe the freedom that formula will bring. Sometimes moms don't know that by giving supplements too early, they're actually preventing their body from setting up a good foundation for milk production, and they might have trouble making milk later on. So in this podcast, what I'd like to do is look at a few of the reasons that mothers often say they want to do both, breastfeed and formula feed, and maybe look at some strategies that you can use to help moms choose exclusive breastfeeding. You know, today most major organizations, such as the American Academy of Pediatrics, recommend that babies get nothing but breast milk for the first 6 months of their life. Why is that? Well, research shows exclusive breastfeeding really does make a difference. Babies who only breastfeed during the first 6 months get the best nutrition to help them grow and develop well. They get antibodies that help fight infection and serious illnesses, not just in the early months of babyhood, but these are actually benefits that last throughout their lifetime. Breastfed babies are less likely to develop leukemia and diabetes. They're less likely to be overweight. They're less likely to die from sudden infant death syndrome. Moms who breastfeed also have less chance of developing breast cancer, ovarian cancer, and diabetes. And we've even learned that mothers who breastfeed are less likely to develop heart disease, and it lasts well past menopause. So these are actually some benefits that are important for the mother. A lot of times mothers have heard there's good reasons for the baby to breastfeed, but they didn't realize there were benefits for them as well. We also know from research that the longer and more exclusively babies breastfeed, the better their health outcomes are going to be. Now, exclusive breastfeeding is so important that the United States has actually set some Healthy People 2020 goals. Our goal for the year 2020 is for 46.25% of babies to be exclusively breastfed all the way to 3 months, and for 25% of them to be breastfeeding till they're 6 months old. But in the United States currently, we have a little work to do to help moms to understand why this is important. And you can see from this chart that the numbers of WIC mothers who exclusively breastfeed is even lower. Research shows that most moms not only don't reach the breastfeeding goals that all the health experts have established as important, but moms often don't even reach their own goals. So what is going on? Well, I think it'll be helpful to understand that moms who feel they need to use formula are really impacted by a lot of things going on in their life. And I think your job as a peer counselor is going to be to kind of ask some questions and find out what's going on in her life. So let's begin by looking at some hospital factors. Now, we know that there are a lot of medical reasons that sometimes formula really is needed. For example, maybe the baby is not growing well or putting on weight well enough. Maybe the mother's milk production has been delayed right at first. If formula is needed for a medical reason, I like to remind moms that this is a temporary tool. A lactation consultant and her baby's doctor can work with her to help get the baby back to exclusive breastfeeding. But sometimes formula is given to a baby for non-medical reasons. Maybe it's because the baby is fussy, or the mom needs to sleep, or maybe she is just saying she wants other people to help her feed the baby. Or maybe she was given some formula samples in the hospital. Those little gift bags, those cute little gift bags that have samples, and the mom leaves the hospital believing This means she's supposed to give formula to her baby. There have been some research studies done recently with WIC moms that found that when WIC mothers are given formula as samples in the hospital, many times they're never told that they need to give that, but the moms are discharged believing they're supposed to, that the doctor wants them to use this. So I think our role is to remind mothers that breastfeeding exclusively is what is going to build her milk production, and that if she gives formula too early, it's going to keep her body from working properly to make plenty of milk. Now, it's true that exclusive breastfeeding may take a lot of time in the early days, but you can remind moms it's going to get better. After the first month or so, her baby will become a little more efficient at removing milk, and her supply will be established, and her breastfeeding will get a lot easier. Sometimes mothers give formula once they're home from the hospital because maybe their baby is fussy or cries, or maybe family members are pressuring her to use formula. Sometimes mothers will say, well, I can't see what the baby's getting. I don't know that my baby is getting enough. And all they see is the baby's a little fussy. Well, I think there's a great trick to share with moms, and that is, you can't see what's going in, but you can see what's coming out. So count the wet and dirty diapers, because what goes in must come out. If the baby's having maybe 3 or 4 stools and 4 to 6 wet diapers every 24 hours, after about day 3 or 4, he's getting enough. Her doctor can show her whether the baby's growing well and gaining weight, and that's another good sign that the baby is doing well. Sometimes we encourage moms to bring the baby to the health department or to the WIC office and weigh the baby there so that we can check the baby's weight. And that sometimes is a great self-confidence for moms to know that they're actually doing really well. So what are some things that you can do? Well, as a peer counselor, remember that moms are looking to you for reassurance that they're making enough milk. So remember your 3-step counseling principles. Ask open questions to explore her concerns about making milk. Affirm the fact she's worried about the baby. This is a good sign. This means she's a great mother and she cares about her baby. So you might say something like this: I'm glad you're worried about that. Good moms are concerned about their baby and making sure that they're making enough milk. Let's talk about how we can help reassure you that you are making plenty of milk for your baby. And then you can teach moms how to get a good start with exclusive breastfeeding in the early days. If you have not watched the podcast yet on how the breast makes milk, make sure you take a look at that. That's got some great information you can pass along to moms. Pregnancy, I think, is a really good time to begin talking to moms about breastfeeding and how her body is going to make milk, because that will help her to be prepared when she gets to the hospital. And don't forget, you have breastfeeding experts at WIC and in the community who can help if a mom is truly not making enough milk or the process isn't working quite the way that she had hoped. If moms start feeling unsure of themselves, maybe take them back to their original goals for breastfeeding. I like to do that often to moms and say, what was your original goal? What did you feel was important for you? If their goal was to breastfeed for 3 months or 6 months or even a year, the best way to reach that goal is to breastfeed exclusively. I think sometimes the most important thing is to just be there for new moms, reassuring them that they really are doing a great job. I'll never forget one time a mom that I once knew who called me because she was convinced that she needed to start supplementing. I told her that at WIC we would support whatever she felt was best, but since I knew that it had been important for her to breastfeed at one time, I said, I'd like to help you reach the goals you've set for yourself. So I asked her just a few questions. I said, well, tell me why you think you're not making enough milk. And here was her answer: the baby just seems to be eating a lot. And I said, well, how often is this baby nursing? And she said, about 10 times every 24 hours. And I said, okay, about how often is the baby wetting and dirtying diapers? And she said, constantly. He has probably 5 or 6 dirty diapers every day. About every time I nurse him, he has a dirty diaper. And I said, well, tell me what the doctor is saying about the baby. And she said, well, the doctor's very pleased. He said he's gained a lot of weight and he's already into his 3-month clothes. And I said, tell me what your family is telling you about breastfeeding. She said, well, my family is telling me he's not getting enough. Was this baby getting enough breast milk? Absolutely. She was clearly doing a fine job with breastfeeding. She just needed somebody to tell her that. So when I reassured her she was a great mom, her baby was doing great on her milk, and then when she understood why babies need to eat so often, she relaxed, and she decided maybe she was going to continue breastfeeding. You know what? She did. She breastfed exclusively for 6 full months, and she continued nursing until her baby was 18 months old. Later, she went on and breastfed her second child and her third child, and then WIC hired her as a peer counselor so she could help other mothers feel confident that they can breastfeed too. So, never underestimate the power of your support. It truly does make the difference.